Welcome back to Commit to Quit, our special in-depth look at smoking and ways to kick the habit once and for all. So far, we've discussed the destructive ingredients inside every cigarette, which includes formaldehyde, used to preserve dead specimens, and arsenic, usually found in rat poisons. We also talked about the psychological impact smoking has on the body. Well, this half hour, the help you need to kick the habit to curb for the good this time. Thanks for joining us, Andy Degling. He is a smoking cessation specialist. Now, tell us exactly what that is.
A smoking cessation specialist is a person who's been trained in nicotine addiction, also the ways to motivate and support a person during a quit. So it could run the gamut from someone who's a professional counselor, an MD, anyone in the medical field. Also, highly trained are those individuals who have certification for the Connecticut Quit Line program.
Oh, we've been talking a lot about motivation, finding out what is your main motivation for quitting. And once you have that motivation, you need to find a program to quit, to make that a reality. We're going to go over the different programs, but is there one program that seems to have the most success?
By program, you mean a type of medication and or counseling?
Well, either, yes, and there's the patch, and there's acupuncture, and all of those things. Is there one that seems to have the most success?
I am on the fence with that. Two do very, very well. One is use of Chantix and or Wellbutrin, and the other is nicotine replacements. There are two nicotine replacements which require a doctor's prescription, and of course the Wellbutrin and Chantix also need a prescription. Coupled with that, if you look at nicotine replacement in combo, for instance a patch along with use of gum or a lozenge can be very, very effective for breakthrough craving times, but they work very well.
That's probably the one maybe we hear the most about. There's a lot of commercials. You can get it at CVS or any other drugstore.
Correct. Over the counter, you can do that, except for the nasal inhaler and the spray. Those you have to have by prescription. But once that is done, it's very important to communicate that with a doctor, because some of these medications can be very effective, and when a person does stop smoking, what happens is any other prescriptions they may have been taking now need to be altered. Blood pressure is a very good example of that. Some people have reported feeling very dizzy, weak. The cigarette smoke actually is damaging to the medication, but once it stops, now they have to lower the dosage of medication under a doctor's advice.
All right, let's talk about the other ways to quit.
All right. If we're looking at acupuncture, very little evidence to support that that is helpful. If we look at hypnosis, that has some good effects, no question about that, but if it's coupled with counseling, that improves what can happen there. Different types of techniques that we use in counseling also are very, very effective. Cognitive behavioral therapy is very, very successful, and when we couple that and help them understand what was going on with them at that point and how triggers, stressors in their lives weren't handled except by a cigarette, and now they have alternative styles of coping with things without a cigarette. Now you're making progress.
All right, well, let's talk about going cold turkey. Is that something that you suggest? Because somebody, maybe last minute, they're saying, you know what, I'm going to quit tomorrow.
If it's a spontaneous quit, the studies have shown that a spontaneous quit can actually be more effective than a planned cold turkey quit.
Really?
Yeah.
Okay, why is that?
Not sure. It's out there in the literature, and I've met people who have done it just that way. But it seems like a spontaneous quit, there's no fear buildup, there's no worries ahead of time, and they just do it, and that is it. But overall, it's very, very rare. Cold turkey quits can be done, but it is not the preferred method. So what happens is a lot of times people aren't prepared for all the different things which will come up with cravings, withdrawals, and then stressors, and how to handle them differently than with a cigarette.
All right, well, bottom line here is to figure out what program is going to work best for you and try as hard as you can to stick to it. It may not work the first time, but not to give up.
Correct. You're looking between anywhere from 3 to 10 times, depending on what's going on for that person, how motivated they are, what they identified as values. For instance, earlier we talked about how much money was saved in the car that can be purchased. It all depends what's going on for that person. Maybe there's family that they want to stick around for and see grandchildren happen.
Again, the motivating factors.
The motivating factors, exactly.
Thanks so much for being with us.
You're so welcome.
Great.